Well, hello and welcome to our informational video. I'm Charlie Hull, a marketing coordinator with Blessing Health System, and we're glad today to be in the Illini Community Hospital Emergency Department with Dr. Thomas and Dr. Pyatt. And gentlemen, we thank you for joining us today. We're talking about strokes today, and when you hear about strokes, you also hear that stroke is not a joke, time loss, there's brain loss, there are a lot of things go into that. We're going to hit on a couple of key things. And Dr. Thomas, let's start with you. One of the things we want to tell people is if they feel like someone is having a stroke, we want them to dial 911.
Absolutely. The very first thing that you can do is to reach out through dialing 911, because the best thing we can do is to get you assessed by a professional medical team to see how serious the signs are, to see how real they are. Because we don't want to push them off as they're not important, because they very well could be real signs of a very significant disease. And so by dialing 911, we get that team of medical professionals answering us early, and they can assess and determine, yes, you need to go to the hospital now. This can be very critical. So by dialing that, it gives you the best chance of early assessment and intervention.
And Dr. Pyatt, one of the things we hear people talk about sometimes, especially in a rural community like this one, sometimes it takes a long time possibly for that emergency personnel. They said, well, maybe I can just put that person in my car and take them myself. And while they can do that, it gives you here in the emergency department an advantage that they call 911 so you can be ready for that patient.
Yeah, absolutely. I mean, they might be able to beat them time-wise, but they can't intervene if there's some first intervention that needs to be done en route, and then they call us and give us a heads up. We can be ready to deliver the care as quickly as possible. Most importantly, CT. If they come in through triage, that's extra minutes. If they come in by ambulance, we've already been warned they're a possible stroke, they'll go directly to CAT scan, which is the most important piece of information.
There are some pretty common signs when it comes to strokes, and they've kind of come up with an acronym like they do in healthcare very often, and that's FAST. And so let's go through that. First of all, the F in FAST is face. Let's talk about some of those things that people might be looking for, Dr. Thomas, in someone's face that might be telling them this person may be having a stroke.
Yeah, one of the best things that we can weigh on is when family notices that someone's face might be droopy. So they might notice that their eyelid is heavier, is covering their eyes, or maybe their smile is not upright on both sides. It's kind of flatter on one side. Maybe their cheek or the side of the face seems droopy when the other side is normal. And so whether they see themselves in the mirror when they wake up and they see that change, or if a family member notices, that's a big change. And that's not normal. So we have to identify that as that is a early and very common sign of a stroke. And so if that's noticed, absolutely you got to seek care.
The A in the FAST acronym, Dr. Pyatt, is arm, and you kind of tell people that they can see if they can raise both arms the same, I suppose.
Yeah, exactly. There's a Cincinnati Stroke Scale score that's pretty predictive of whether a person has stroke. Paramedics use that for us. And that's one of the things that they do. And it can be subtle. It might be that their arm is just kind of like, just kind of drifts a little bit. But it's a huge indicator that there's something going on. Not a whole lot else causes you to have that kind of disability.
The S stands for speech, and sometimes people's speech, it may be blurred, it may be slurred, and it may just not make any sense, kind of garbled, and that's something they can definitely be aware of as well.
Yeah, the biggest thing that we want to notice is a change from their normal. So there's not a specific way a speech will change in a stroke. One person, it might be their words is slurring. Somebody else might say just be completely incoherent in their words, but their words are clear. So that speech is different with these different strokes, but it's a change from their normal. So when someone's speech changes for no reason, that can be a sign of stroke and that can need to be evaluated.
With the speech, Dr. Pyatt, does the person, when they're having a stroke, do you think they can usually tell when their speech is a little messed up, or does it seem normal in their mind?
Oftentimes they are aware of it, and become very frustrated. They often become cheerful and very anxious. Yes, oftentimes they notice it when they're trying to talk to someone on the phone. That's the first time they ever pick up on it. Some of these people on the phone, and they maybe have no other idea that they're having any trouble until they try to make a telephone conversation and that makes any sense. So oftentimes they're very aware.
And then the T in FAST is time to call 911. Now, is it a combination of all three of those symptoms? Could it be one or two? I'm assuming not every stroke looks the same.
Yeah, absolutely. So the T in FAST is time. Time is your friend and your enemy with a stroke. By acting quick, when you have any of those, like you're saying, Some patients might present with only one out of all those, and that's only the more common ones. There's other ones that they might present to as well with stroke-like symptoms. But time is going to be your best friend. So the quicker you call, the quicker you reach out for care, the quicker that we can get the CAT scan and evaluate the person, the best chance that they're going to have for us to offer medications or transportation that's going to get them the best care that they need.
People have heard the term stroke, I'm sure, a lot of times, but Dr. Pyatt, what actually is happening inside that person when a stroke is occurring?
Yeah, so it's, a lot of people are pretty familiar with heart attack. They understand what that pathology is because a lot of people have had those arteries opened up. They said, I've had a stent, I've had a bypass. And it's a similar event going on with the brain. So over time, there's a narrowing of an artery that feeds to your brain the oxygen that it needs to visit the blood. So over the time, that narrowing becomes a little bit more than a plaque or a clot. One blocks it off suddenly. That's when they have lack of oxygen that feeds that brain and causes the stroke symptoms that we see.
When you talk about the time, that's the time you're really talking about. Less oxygen to the brain means more damage, and sometimes damage that can't be reversed.
Absolutely. So again, that time is critical because you can have those blocks, and if it's not reversed either through medication or intervention, then that brain is deprived of that oxygen-rich blood, and it can get to a point where it's irreversible and it becomes permanent. So that speech or that arm weakness or that confusion or that facial drooping, it is left permanently because the brain itself is damaged to an extent that it can't be fixed.
And at times, if you can catch some of those symptoms early on, recovery can be very, very good for people.
Yeah, sometimes you see complete recovery, and it almost just right before your eyes. It's spectacular, and sometimes not. But more often than not, their outcome in at least 3 to 6 month period of time is going to be better if things don't actually offer some type of medication.
Lastly, let's talk about the role of a hospital like Illini, as a critical access hospital, when it comes to stroke care. What are some of the things you're going to be doing and the steps you're going to be taking to help get that person to that next level of care?
Well, the best thing is that we are here. Even though we're a rural community, it's even farther away to another facility. So by getting them here, calling 911 and getting that CAT scan and assessing them as early as we possibly can, it's going to be the quickest way to gather information to determine where they need to go and where is the best place that they need the quickest and necessary intervention that they need. And so it's an amazing opportunity to have this hospital in this rural facility because it gets them information and treatment even faster.
Well, gentlemen, we thank you for sharing the information. We encourage people, if they want to find more information, they can visit the blessinghealth.org website. And also, we want you to remember FAST, face, arm, speech, time. Very important when it comes to stroke. Thanks for joining us today.
Thanks a lot.